Now moving on to our dental anatomy section. I'm going to do this section here to try to make your legs a little bit easier. So we are going to go specifically into different types of medications, but I would like to go into some shortcuts for you. So some medical shortcuts that will help you in remembering the names. Okay, so this is going to help with those generic names. And we have our ACE inhibitors. Okay, so ACE stands for angiotensin converting enzyme. So that brings us back to our physiology. Okay, so we remember the angiotensin. Now, hypertension and congestive heart failure are what these group of drugs are used for. So we have the ending is opril or april. Okay, so examples of this would be captopril and enalapril. Okay, so these are going to relax smooth muscle and increase vasodilation. Okay, so I just want to go over one last section before we get to the National Board question and answer. So we'll start with diabetes medications and then we'll review anticonvulsants. So metformin, this is the big one, metformin. Make sure you understand metformin. This is so easy enough. We finished up our pharmacology section and now we're going to be doing our National Board question and answer, which I'm sure you'll all ace. Now on our last section, and we'll be doing our National Board question and answer. So we'll start off with our first question. Which of the following medications would increase bleeding the most? We are now going to do our National Board question and answer. So our first question is, Epstein-Barr virus is implicated as the etiology in which of the following conditions? A, thrombocytopenia, B, mononucleosis, C, herpangina, or D, pernicious anemia. I'll give you a moment. Always our mandibular teeth are going to emerge first, okay? So that means your mandibular molars will be erupting before your maxillary molars. Also, your hard tissue formation for primary teeth, 4 to 6 months in utero, okay? Now, this will, again, be something you'll see in embryology. Next, we have our calcium channel blockers. So these are going to reduce blood pressure by creating systemic vasodilation. The adverse reactions with our calcium channel blockers are going to be xerostomia as well as gingival enlargement. We talked about this earlier, so make sure you know all of your drugs that cause gingival enlargement. Further into our histology and embryology, touch on some things that we've already covered and go further into apposition and maturation. So epithelial root sheath, otherwise known as HERS, is a sheath or a membrane, and its function is to shape the root and induce dentin formation in the root. We are going to do a quick segment on candidiasis, and we are discussing white lesions. So first off, we have 3 main types that I want you to focus on here. We have pseudomembranous, which is also called thrush. Okay, we have central blunted punched out papilla. Now this is something you'll see for sure. If you get a case study, they'll probably say something about punched out papilla. They'll also